All of our patients need extra support. We need community.
The case management, the counseling, the education through health, one shop, one deal, you get it all.
We just see them as a person, we see them as an individual.
Finding out as a 37-year-old you have heart failure was a pretty hard thing to swallow at the time. I'm Patrick Thayer Humphrey. I'm 37 and a half. I've been a patient for Venice Family Clinic for about a year and a half.
So here at the clinic, I focus on the care of adult patients, and I have my own panel, and then sometimes meet new patients who need an urgent visit. And that's how I met Patrick.
My first meeting with Lisa was after I was trying to get a work release, not understanding the severity of what was going on still. And she was like, I can't let you go to work. You need to take care of this.
It was during that visit that I noted a 5.5 centimeter thoracic aortic aneurysm. So we discussed the need for vascular surgery intervention in order to prevent a potentially life-threatening rupture of this aneurysm. The first thing that we did in order to get Patrick on the road to being able to have this surgery was to get him hooked up with our amazing health insurance enrollment team. After he was insured, he received an eviction notice. That became a huge concern.
After I was officially homeless, Venice Family Clinic stepped in and helped me try to find resources and a hotel for right before the surgeries.
This is one of the reasons why everyone needs a medical home with a PCP who is looking out for them, who knows their care and who has their urgent needs at the front of their minds. It was a huge coordinated effort. It touched on every aspect of care that we provide. And if it was just me, he wouldn't have had the surgery. His surgeon, Dr. Downey, texted me and said, no exaggeration, you saved his life. He thought that he wouldn't have survived.
My name is Belen Arangure. I am the director of the Care Management Department. Care Management is a team of highly compassionate, dedicated individuals that are committed to walking alongside our patients, especially those with complex needs, just overcome the many hurdles that are part of our healthcare system and meeting them where they are with some of the personal things that they're going through in their life.
Mi nombre es Rosa Palma, tengo 26 años. Y tengo 3 hijos. Si necesitaba hablar con alguien, porque estaba pasando un momento difícil donde no tenía dónde vivir, estaba como buscando atención médica y Daisy llegó en el momento preciso que necesitaba asesoría en ese lado y Daisy me refirió a muchas cosas y eso me ayudó mucho.
The comprehensive assessment revealed that she was staying with her 3 young children at a local church. She was also struggling with a lot of abdominal pain. She had shared with Daisy at the time, her assigned lead care manager, that she was really concerned whether she had something more severe and was afraid for the future of her children because she didn't know really what it was. So she quickly jumped into action by processing a referral to the health plan to gain housing navigation. She referred her internally to our Early Head Start program. Because she had 3 small children, all under 5, she had also made sure to inform Rosa that she would be that support system for her to get her reconnected to her GI specialist.
Tenía cálculos en la vesícula y tuvieron que operarme porque como mamá estaba muy asustada, que era el dolor, que si era grave, que si me iba a pasar algo. Me sentí en confianza con la clínica, con el personal. Estoy muy agradecida con la clínica, con el personal y con todas las personas que han puesto de su tiempo para ayudarme, para mis hijos, ser mejor mamá.
My name is Edgar Lopez. I grew up here in Venice, California. I have 3 beautiful children. I started drinking when I was like 14, maybe 15 years old. In my family, there was a lot of alcoholism. I've had my uncle, my aunt, my cousins, they've all died from, alcoholism, cirrhosis of the liver.
My name is Amy Ashraf. I'm a nurse practitioner here at Venice Family Clinic. People who suffer from alcohol use disorder often have a history of trauma. They're often medicating something.
My father passing away had a big impact in my life. That's when my drinking got worse. Alcohol affected my relationship with my kids in a bad way. I wasn't there for them. I mean, I was pretty desperate and I didn't know where to turn.
I was introduced to Edgar Lopez by his sister Griselda. She called me one desperate night and said, Rose, I need you to help me. My brother's dying. I don't know what to do. He cannot stop drinking.
When I first met him, he was 32. We ran labs. I ran a liver ultrasound. The ultrasound confirmed he already had early cirrhosis.
We use various interventions like cognitive behavioral therapy, motivational interviewing. We use mindfulness. We use meditation.
Rose stepped in, so I didn't believe in myself, and she kind of just like put that little spark in me. Like she gave hope to the hopeless person.
Grieving the disease, letting it go. It was painful for him. Rose, I'm not the same person. I said, I know you're better.
I was really excited to check in with him and see how he was doing, actually. And when I walked into the room, he looked great. And so when the labs came back, his liver elevation that I had seen the few years prior had totally resolved. And he told me, I haven't had a drink in a year.
I started facing life, which I hadn't done in years. One day when I went to the beach with my kids, the beach was packed, but I just felt like it was just me and my kids there. I never had that serenity, that peace. I hadn't had that for a while, where time stood still, and I just enjoyed every single second, every millisecond of the moment. I was like, man, you've been missing out on this. I'm forever grateful for it.
I think Edgar's story really nicely illustrates the importance of having additional services beyond clinical medical care. And I know that when I see a patient, I have a whole team behind me.
Venice Family Clinic is something that, it's available for everybody. If you really want the help, they're there for you. There's hope out there. You're not alone.